ask the team to pull up the presentation and also say good afternoon to the mayor and council and members of the public. I'm Lee Wilcox, Deputy City Manager for the City of San Jose, and joining the presentation today is Dolan Beckel, our interim Deputy City Manager, as well as Ray Reardon, our Director of the Office of Emergency Management. Today we're going to cover recommendations around extending the local proclamation, our local emergency proclamation, which Ray will go over, and then you'll hear from Dolan and I around our COVID-19 Emergency Operations Center response with the emergence of the emergence of the Delta variant locally. So with that, I'll turn it over to Ray, who will walk us through the emergency proclamation extension.
Good afternoon, Mayor, Council, and others attending today's session. I am Ray Reardon, the Director of the City Manager's Office of Emergency Management. As required by local ordinance and the Emergency Services Act, we've returned after 60 days of the last extension to request another extension due to the current conditions of the COVID-19 response. You have in your agenda the memo as well as the resolution for such action. With that, I'm going to turn it back to Lee as part of our presentation on the information related to this.
Thank you, Ray. And can we go to the next slide, please? Thanks, Dolan. Since May of this year, the administration and the council have worked together to demobilize the city's Emergency Operations Center, which closed on June 30th. We engaged in a thorough and thoughtful process to move our long-term recovery structure and recovery items onto this roadmap. We also built these items into our committee work plans and separate council items to ensure transparent communication between the administration, the council, the members of the public, but also give the council the opportunity to take action on these items if need be. Due to the unexpected and unplanned emergence of the Delta variant, we are now in a place to readopt a response posture by reactivating our Emergency Operations Center, which we did yesterday. As such, response, recovery, as well as all the other important items on the city roadmap will need to happen in parallel, placing strain on budget and staffing for the months to come. Next slide. As I mentioned yesterday, we did reactivate the city's Emergency Operations Center. This activation is what we're referring to as a stage 4 in emergency management, where we'll be focusing on monitoring the local situation, coordinating internally and externally, and communicating with our residents and workforce. While our original activation that most of you were a part of last year included hundreds of employees and an emergency operations center with huge operational responsibilities, this activation is a much more traditional EOC model with a majority of operations remaining in departments and those directors serving in the Emergency Operations Center. This approach is needed so that we can do recovery, response, and the roadmap items at the same time. As we continue to monitor, we will reassess our activation level and personnel and the structure of the Emergency Operations Center as we move forward. In addition, we'll be updating the council about our response and covering what has changed, what is driving that change, and what is the city or our partners doing around these 9 topics, so that we can keep the council and public informed of our efforts. We do not plan to go into recovery items as part of these reports, as we have built those into existing communications between the council, mayor, and city administration. But as we learn more about the conditions in our local community and how they change, we will keep the council informed through a variety of methods. And with that, we're going to start with our update, and I'm going to hand it over to Dolan to go over the pandemic update.
Thanks, Lee. Good afternoon, Honorable Mayor, council members, members of the public, and city staff. Dolan Beckel here, Interim Deputy City Manager and serving as the Emergency Operations Center's Assistant Director. The Delta variant has dramatically impacted the COVID-19 landscape, and the situation is evolving very rapidly. I'll be sharing today what we currently do know about the Delta variant at the national, state, and local level. Keep in mind that the data and the insights on the data are changing daily, if not hourly. And due to the fact, as its name implies, it's a novel or new coronavirus, it remains very unpredictable. The evolution of this virus creates different variations or variants of the virus. There are variants of interest, and then there are more severe variants of concern. The dominant variant of concern we are monitoring is the Delta variant. What we do know about the Delta variant is that it, one, leads to increased transmission of the virus between individuals, resulting in more hospitalizations and death among unvaccinated individuals. Two, through rare, what we call breakthrough cases, vaccinated individuals can be infected, and they are largely experiencing mild to moderate symptoms, often unaware of the infection. Number three, individuals with the Delta variant are getting sick faster. And four, it is expected that it will take at least 12 months to get to a return to normal state where COVID-19 can be treated in an approach and scale similar to that of chickenpox or measles. In terms of transmission, more younger people are getting infected by the Delta variant compared to earlier variants. Second, unvaccinated individuals are really driving the surge of the Delta variant today. And three, worse breakthrough cases remain a possibility. The daily number of new COVID-19 cases in the United States has reached high levels, second only to the pandemic peak during last winter of 2020. As such, the response in the United States to the COVID-19 pandemic has changed dramatically. The U.S. is again reporting the most cases globally at a 7-day moving average of 114,000 new cases daily, according to the CDC as of August 13th. Southern states are reporting the worst outbreaks with high levels of community transmission across other parts of the country. In California, newly reported cases and risks for unvaccinated people are increasing. Across California counties, there are several counties with very high 14-day changes, up to 500%, such as Glenn, Lassen, Sierra, and Calaveras counties. Santa Clara County's 14-day change in new cases is up 44%. In Santa Clara County, as of August 12th, the 7-day rolling average was 268 new cases. Like the national trend, this number is second only to the pandemic peak during the winter of 2020. The relatively positive news is that unlike the start of the pandemic, thanks to the high percentages of overall vaccinations in both the county and the city, deaths due to COVID-19 are not trending upwards at the same pace as new cases. I do want to clarify the hospitalization message. Intensive care units, or ICU, availability beds in the county remain relatively high at this point, but the hospitalization rates are increasing. Right now, Santa Clara County hospitalization rate is much lower than the state. However, this situation could change quickly. Unfortunately, the high vaccination rate is not shared across all San Jose communities, and we will continue to focus on 13 priority areas that continue to experience low vaccination rates. I'll now turn the remainder of the presentation back to Lee, who will provide an update on the national, county, and city response to the Delta variant and continued vaccination efforts in priority census tracts.
Thank you, Dolan. Next slide. Next slide. So the team, we've done our best to summarize of all of the information at a federal level, state level, and local level regarding changes to policy and operations regarding the Delta variant. And we were updating this up until 15 minutes before we started with new information coming out from our president. So at a national level, a few weeks ago, the CDC did announce interim public health recommendations for fully vaccinated people. And just to go over a few of them, this includes fully vaccinated people wearing masks in public, indoor settings, in areas of substantial or high transmission, and that fully vaccinated people that may want to wear a mask regardless of the level of transmission, particularly if they have family members or in a household with someone with immunocompromised or high-risk health. Also recommending universal indoor masking for all teachers, staff, students, and visitors to school, regardless of vaccination status. Last week, on August 12th, the Food and Drug Administration amended their emergency youth authorization for both the Pfizer and Moderna vaccines to allow for the use of additional doses in certain immunocompromised individuals. And we'll get to that a little bit later. Actually, can we stay on the national slide just quickly? And then today, and this is more internally focused for us, but today President Biden announced the continued support of COVID-19 response and recovery assistance by extending 100% federal funding to state, local, tribal, and territory governments through the end of the calendar year. And so as we need additional resources and reimbursement to fund the recovery, we'll be able to do so through FEMA. Next slide. Not on this slide because the update was given late last night, but last night Governor Newsom signed a new executive order at a state level that help expands the state's healthcare workforce by allowing out-of-state workers to come as reinforcement. It also provides flexibilities to schools suffering from low staffing levels by allowing them to rehire retired teachers and staff and give flexibility for school operations. It also requires all schools, regardless of public or private, and state workers to either show proof of vaccination or be tested weekly to continue work. At a local level, the county has also announced a new public health order, including requirements to wear face masks coverings indoors regardless of vaccination status, with a few exemptions that we've gone over in various flash reports. Next slide. Also in that public health order, the county included recommendations urging businesses and government entities to follow 4 specific recommendations. And that includes implementing mandatory vaccinations for all personnel, subject to very limited exemptions, move operations outdoor where possible or feasible, prohibit personnel who have not been fully vaccinated from engaging in work-related travel to certain geographic areas in the United States and throughout the world, and requiring all personnel not fully vaccinated to obtain frequent testing. So given the lay of the land, as I mentioned, we've started to re-engage the county and some of our partners on what we need to do in the coming weeks and months related to the Delta variant. And so we're going to hop into some of those right now, and I'll go ahead and start with our vaccination efforts. Thank you. In terms of the city response, our vaccination task force updated roadmap and work plan is to continue to focus on the city's role as primarily providing vaccination support to the county and healthcare providers. Through these partnerships with the county and other providers, the city has become the first major metropolitan large city to reach 85% of residents with at least one first dose. In addition, throughout the summer and through the remainder, throughout the remainder of the summer, continuing to partner with the county, Kaiser, Safeway, AUG, Bay Area Community Health, the city, without the county's support, administered 25,000 vaccinations directly to our own residents. As mentioned, the Delta variant is causing a surge of COVID-19 cases locally, and the city is at a larger perspective, better protected place with over 85% of its population vaccinated, but there is still work to do as that vaccination rate is not equally distributed across the city. And so our task force is going to continue to collaborate with the county and on providing and sharing information around data and census tracts and tactics around these census tracts that will continue to experience lower rates of vaccinations. The task force is currently working with our library staff, PRNS staff, Public Works, and other city departments to make facilities and parks readily available to the county for more mobile vaccination events in the coming weeks. In addition, we've instructed our CDBG recipients to continue to support outreach operations through flyering and knock and talk activities in the most under-vaccinated areas of our city. Currently, after discussions with the county, our vaccination task force is also going to continue to provide the people power through temporary employees, which we've discussed as our vaccination champions. So with the federal funding, 100% federal funding being continued through the end of the year, we can continue our vaccination champions and continue to support county efforts on these pop-up vaccination sites. We'll also be working with the county and other partners to develop a communication strategy that will focus on two important things, new emergence, but the first is on youth and parents as pediatric vaccinations hopefully become available for 12 and younger in late September or October. And then also working with the county on the third dose, when and if that is available. And the Biden administration has started to signal an announcement later this week around that. Next slide. With the help of the city's vaccination task force, our community partners, the county, as well as the council offices, our countywide vaccination rates have increased substantially across our community since we last reported to you in June. The most dramatic increase is seen in our Black and Latino, Latina, and Latinx populations citywide. The vaccination dashboard shows overall resident vaccination rate of 85.7%, or those that are 12 and over, which was up almost 7% from the last time we reported. However, I do want to state that the county has not updated the vaccination dashboard since late July, so some of these stats could be behind. Given the need to focus on those that are unvaccinated, and also with the disproportionate rates of vaccinations geographically throughout our city and racially, the team has focused on 13 census tracts for continued effort with the county and our partners. Next slide. All of the strategies planned through the vaccination task force that you've heard and that we'll be hearing about in future meetings will focus on priority census tracts identified through the county data. These census tracts span across several council districts and throughout the city. And the team will continue to work to get vaccinations in arms while there is a need in these census tracts, by supporting the larger county efforts and going over the items that I've already said. We intend to continue partnering directly with council offices who have these census tracts in their council districts. And we will be working with you hand in hand through the vaccination task force on these efforts. And I did want to point out, it has been, we've become aware that some of the county data and the reporting data specifically to Alviso might be incorrect. So we're working with the county to refresh that. So Alviso might fall off of this list, just as a footnote. Next slide. One of the areas we'll be talking to you about, because it has been shifting so much, is around kind of our hybrid work and our facilities and resources here. City Hall did reopen to the public on August 2nd. All employees and members of the public are required to wear masks, and employees are required to complete daily health screenings when entering City Hall. On August 10th, we made a decision to delay bringing back additional employees to facilities at this point, and we'll continue to monitor the situation and when it's appropriate to bring additional folks back. With that said, services that we currently have open to our community at City Hall, we intend to keep open. By August 23rd, all employees will be required to show proof of vaccination or submit weekly negative COVID tests. And we will be evaluating cases internally regarding exposures and risk levels to determine when we bring employees back, possibly targeting October 4th if possible. And finally, as shown on the slide, we are exploring requiring all employees to be vaccinated by September 30th. Next slide. To move on to our eviction and rental relief update, new state law requirements under AB 832 begin on October 1st. For rent due between October 2021 through March 2022, landlords can evict for unpaid rent during this period if they submitted a completed application, or if it was denied, or if 21 days has passed without a response from the rent relief program or the tenant that has applied. Landlords can also evict for non-payment for rent for new tenancies that begin on October 1st or later. Courts can reinstate tenancies prior to being evicted if the funds have been approved and is waiting reimbursement. This is what is driving the surge and the need to get as many people into the system as possible. Beyond the existing parameters set forth in AB 832, our city team continues to work as on many of the avenues as possible to pursue changes in law that would further extend the protection for our residents locally. This is being done while simultaneously enrolling individuals in the rental relief program now. Our advocacy to find solutions that work best for San Jose residents is focused on both the state legislature and the governor's office. And housing staff is here for questions if we want to jump in. Next slide. And then lastly, to summarize a few different things before we end, we are actively monitoring food distribution sites and working with our partners. Really interesting tidbit that found fascinating. Since the beginning of the pandemic, the city and its partners have distributed 180 million meals since March 2020. And, kudos to our staff and our partners. Since the winter break, Second Harvest is down 15%, and senior nutrition programs and unhoused residential programs are currently stable with food. And students are now receiving universal meals through schools in almost all school districts throughout the county. We're currently renewing a number of our contracts with our partner to extend through the end of the calendar year and continue on a daily basis to monitor food insecurity levels within the EOC to see if changes are made. Within our digital equity program headed by the library and Office of Civic Innovation, all projects are progressing on schedule, and we're preparing for construction to start in the Independence area this November. In addition, the city has submitted an application to the Emergency Connectivity Fund to the FCC, which expands the city's ability to provide connectivity for educational and learning purposes. Partnership with schools for hotspot distribution is providing almost 4,000 hotspots at the start of the year, and we can expand to over 6,000 through the funding through the Emergency Connectivity Fund if we receive it. In addition, the library continues to have limited availability, but disperse Chromebooks and iPads and hotspots where needed. Within childcare, our summer camps all ended last week and averaged about over 800 youth served weekly. PRNS will operate 31 after-school programs in the coming weeks, and recreational preschool begins at the end of the month with over 22 classes, over 15 locations in the city. One of the things you'll be hearing about in future reports is our isolation and quarantine program. 90% of the people who have used this program are from San Jose, and kudos to Jackie and her team at the county. This program has been very robust and saved a lot of widespread infections. The county has been proactive and reaching out to housing and the Emergency Operations Center about additional funding to continue the program with the Delta variant locally. So we'll be working on that with them in the coming days. And then lastly, as we mentioned last week, Jim Shannon, our budget director, we are currently evaluating the Community and Economic Recovery Enterprise Scope and budget that was passed in June to determine if additional resources are needed for recovery or if we need to stretch out the time, for response and stretch out the budget a little bit. Next slide. So that ends our presentation. We have staff from various city departments and the EOC available for any questions. Thank you, Mayor.